Good morning again, and a very warm welcome to Glasgow. We have managed to produce some really good weather this morning, but not going to take any credit for that, but because you never know when it vanishes. I'm Dr. Shoba, Head of Obesity Action Scotland, and I currently convene and facilitate the work of Scottish Obesity Alliance. It gives me immense pleasure to welcome each of you to this conference today on healthy food environment, time to deliver. The conference is jointly organised by Obesity Action Scotland and the Scottish Obesity Alliance. Allow me to say a few words about the host organisation for the day. And we have in very good time our Minister for Public Health and Women's Health, Jenni Minto, also joining us this morning. Hi. Just getting started. Obesity Action Scotland, we provide leadership and independent advocacy on preventing and reducing overweight and obesity in Scotland. A key goal of our efforts is to support the achievement of the national target to halve childhood obesity by 2030 and explore ways to reduce diet-related inequalities. Scottish Obesity Alliance, co-host of the event, is a coalition of 28 third sector organizations that collaborate to influence policy and practice on obesity prevention in Scotland. And I want to recognize several of the Scottish Obesity Alliance members who are here today in the audience and your support in organizing this conference. And for the Alliance, we do our advocacy through communication, identifying policy-relevant evidence, solutions, and sharing knowledge and evidence among members and other partners. Hence this conference, as well as a fact sheet that would be released shortly today. A healthy food environment has been central to the Alliance's advocacy over the years. Our key asks in this regard include restrictions on advertising and promotion of high-fat, sugar, salt food, HFSS food, a term that you might hear a couple of times during this conference, and also promoting healthier food options. To this end, Obesity Action Scotland's recent research on the perceptions of what parents from low-income households in Scotland think about promotions of unhealthy food in retail stores indicates a strong support for healthy, affordable food and curbs on promotions of unhealthy food. Scotland has made major commitments in terms of setting the national childhood obesity target and initiatives such as the Good Food Nation Act. Obesity is anticipated to have a central place in the population health framework that is shaping up as we speak. Yet, we could do with greater clarity on the levers the framework would offer to progress action on obesity policies in the country. Meanwhile, the latest Scottish Health Survey tells us that 30% of children aged 2 to 15 in the country are at risk of overweight and obesity combined, and 17% for obesity alone. In this context, there are increasing concerns about the continuing obesity challenge, the persistent inequalities thereof, and the delays in policies that are urgently needed to create a healthy food environment. And the time to deliver is now. Hence the focus of this conference on healthy food environment, time to deliver. The conference has 3 key goals, which I thought would be useful for all of us to familiarize with as we go through the day. That could be at the back of our minds. The conference seeks to present key evidence and learnings on policies that can foster a healthy food environment, stimulate discourse on the underlying inequalities, and enable us to identify and pursue innovative approaches towards accelerated action in creating healthy food environments locally and nationally. Today's program is organized around 3 sessions, which you will see in the program sheets that are in the brown bags. If you haven't got one of the brown bags, feel free to take one from the exhibition team outside. The 3 sessions are organized around a particular focus on data and evidence for regulating promotions, advertising, and sponsorship of HFSS food and drink, as well as supporting the delivery of a good food nation for Scotland locally. During the course of the day, we will hear from experts from each of these fields, and we'll have the opportunity for interaction with them as well as with each other. To get the ball rolling, we have here with us today Honourable Minister of Public Health and Women's Health, Jenni Minto MSP, who has kindly agreed to offer the conference keynote speech. Ms. Minto serves as the MSP for Argyll and Bute and has led several consultations on a range of diet and weight-related concerns. Without further ado, I invite Minister Minto to come up and give the ministerial address. Over to you, Minister. Thank you.
Good morning, everyone. What a beautiful day it is, and I'm so pleased to be here to join you and open the 2025 Obesity Action Scotland and Scottish Obesity Alliance Conference. As Shoba said, I have the privilege of representing, in my view, and many others' view, Scotland's most beautiful constituency, and that's not just because of the scenery, but also because of the people. And so many of the people in my constituency are involved in either tourism or also creating some of the most amazing food, or farming or fishing some of the most amazing food in Scotland. So I'm very pleased to be here. It's also wonderful to see so many academics, public sector and third sector organisations able to come together as the poster says, to drive forward our shared mission of creating a healthy food environment in Scotland. So I want to start by thanking Obesity Action Scotland and the Scottish Obesity Alliance for organising today's event and for their vital work all year round. Their work in diet and healthy weight advocacy is helping to shape a healthier Scotland and continues to ensure that the focus remains on the structural drivers that influence our diet and weight outcomes. We're all here today because we share a common goal: to create a Scotland where our food environment supports everyone to make nourishing and healthy choices for themselves and their families. Now, yesterday, I spent most of the day at the NHS Scotland event. And one of the sessions that I attended was our Chief Medical Officer, Professor Gregor Smith, doing an overview of his annual review. And he quoted Hippocrates a couple of times. And if I use the quote that he used, and then I'll move on to one that I think is more appropriate for your event today. He said, it's more important to know what sort of person has a disease than to know what sort of disease a person has. He then went on to say about his annual report, 24-25, Realistic Medicine, Critical Connections. He said, we must do what we can to foster well-being, support healthy ageing, encourage greater upstream prevention of disease, and support our communities to overcome loneliness and isolation. He talked about careful and kind care. Now, as part of his event yesterday, he pulled on a couple of examples, interestingly both from NHS Tayside. One was the Nine Wells Community Garden, which gave people that were attending hospital, but also the surrounding community, an ability to learn more about food production and to create their own food. I think that's really important. When I first moved to Islay, we got an allotment. I didn't know anything about growing vegetables, so I went and volunteered at the community garden. So again, it's bringing people together, but also the important thing, bringing people the connection to nature. But there was also a wonderful, wonderful presentation from the Newfield Medical Centre, which again is in a slightly more deprived area of Dundee, and they've got a new model, but they talk about the importance of holistic care, and the food environment is absolutely important to that. Now, many people who have heard me speak before will recognise that I find this one of the most difficult parts of my portfolio because I love food. And I realise the importance of the education that I had, which really taught me about the way I should be eating a balanced diet. I was also very lucky in that I wasn't being bombarded by adverts, and more on that in a little while. But that's why I think what you're doing here is so important. But the other important thing is connecting with people that aren't in the room and how we share that story. And I would really like to commend, and I've done this before, Obesity Action Scotland, little animation that showed about the journey of 2 different school children to school, depending on the area that they grew up. I think that's incredibly important, and I think we all need to recognise the importance of that. We know that obesity is a significant public health challenge that impacts our population's quality of life and puts pressure on our health services, as Professor Smith was saying yesterday. Our diet is not just a matter of personal responsibility. We know that our food environment also shapes the choices we make every day. Unfortunately, unhealthy food options are often the most affordable, heavily promoted and easily accessible. And I noticed a couple of weeks ago there was an interesting article from a conference, I think, in Mallorca, where the University of Liverpool did evidence gathering, which showed that children eat more after seeing just 5 minutes of food adverts, and they eat more. And that really struck me quite deeply. That's why our government is committed to preventative public health actions to help create a Scotland where everyone eats well and has a healthy weight. This includes legislating to restrict the proportion of less healthy food and drink. Last year we consulted on a comprehensive package of proposals to restrict the promotion of food and drink high in fat, sugar or salt, recognising the contribution poor diet makes to worsening trends in Scotland's health. We undertook an extensive programme of engagement with stakeholders, including a series of roundtable discussions. I know many of you in this room here today contributed to that process, and I would like to take this opportunity to thank you all for your very valuable feedback. We will publish the independent analysis of the consultation responses soon, as well as next steps for the regulation of high-fat, salt, sugar, food and drink promotions, so please bear with us a little longer. It's also important to remember that for restrictions to be implemented effectively, we need to ensure that we have the right support in place. That's why we will work with key stakeholders to develop guidance for both local authorities and businesses to help ensure that all parties understand what is expected of them and their responsibilities for ensuring compliance. And I've had a number of visits to businesses who are reformulating the ingredients that go into some of their products. Most recently, given I come from Argyll and Bute, and we have the area of Lorne in it, one of the areas I was looking at was Lorne sausages, and Malcolm Allen and Larbert do a skinny Lorne now, which has reduced both salt and fat content. The Scottish Government has also long advocated for the introduction of restrictions on the advertising of less healthy food and drink, especially to children. Evidence shows, as I said earlier, that advertising of less healthy food and drink is seen more by people from lower socio-economic groups. Reducing health inequalities is a clear priority of this Government, and we must take decisive action to address this. So therefore, we welcome the UK Government's move to introduce legislation to restrict advertising of less healthy food and drink, and will be supporting its implementation in Scotland. And as set out in our 2018 Diet and Healthy Weight Delivery Plan, we also remain committed to developing proposals to strengthen outdoor advertising restrictions for food that is high in fat, salt or sugar, which goes back to the animation about the different journeys that children have to either places of education or sport. Today, you will also hear about the important work to achieve the vision of Scotland as a good food nation. I know many of you will have a keen interest in the panel discussions this afternoon on delivering this important policy at a local level, and I'm very disappointed that I can't stay longer because I was involved in interrogating that bill when I was on the Rural Affairs Committee. Our Good Food Nation Act places duties on Scottish ministers, local authorities and health boards to produce Good Food Nation plans. And these plans will set out the main outcomes to be achieved in relation to food-related issues, the policies needed to do this and the measures that will be used to assess progress. A great deal of work and input from many stakeholders, such as yourselves, has gone into preparing the draft National Good Food Nation Plan, which will be laid before Parliament soon. The recommendations from the parliamentary scrutiny process will inform the final version of the plan, and I very much look forward to the publication of our first Good Food Nation Plan later this year. Our intention is that relevant authority Good Food Nation plans will follow as soon as feasible. We look forward to working with relevant authorities when they are developing their own Good Food Nation plans and have been working at pace to provide a range of support in this work. This includes a guidance document setting out the legislative requirements and delivering a workshop to facilitate discussions on the process of developing a plan. None of the work I have mentioned sits in isolation, and we must consider the health of our population holistically. In partnership with COSLA and wider partners, we will soon be publishing a population health framework. As Shoba said, it's shaping up as we speak. We worked with our wider partners, including many of you, to develop our thinking, and were given a clear steer on the need for a national framework focused on prevention and the socio-economic drivers of health. The framework will consider what action can be taken to mitigate the socio-economic drivers of ill health, to build a Scotland where our places and communities can positively support health and well-being. It will focus on prevention to improve the building blocks of health to ensure that the good progress we've already made can continue into the next generation. And I facilitated some of the round tables that we had, which had people from business, from third sector, but also from important organisations like Public Health Food Standards Scotland as well. And my feeling at these meetings, and the message I was trying to get across, was we can't have a healthy Scotland if we haven't got healthy businesses. And to have healthy businesses, we need healthy people. So it's that continuum that we need to really work forward together to solve. I want to finish by recognising that reforming our food environment requires collective leadership, and the contributions from every single organisation in this room are absolutely vital. Only together can we deliver real system change to support everyone in our communities to thrive and embrace healthier choices. Thank you again for allowing me to come along and open today's event. It is a fantastic agenda for the rest of the day, with exciting presentations and panel discussions, and I am very sorry I can't stay for longer. But I do hope you have a great day and a productive day, and you leave with ideas and inspiration for the year ahead. And I said I would finish with another Hippocrates quote, and he said, "Let food be thy medicine, and medicine be thy food." Thank you.
Thank you, Mr. Minto. Thank you for the insights and also potential to have policies coming in the pipeline pretty soon, including the population health framework, where these two would have a pivotal role with a focus on prevention. So that's quite encouraging. The Minister has agreed that she would take a couple of questions. So if you have a very urgent question that directly pertains to the theme of the conference or the Minister's speech, this would be a good time to raise your hands. We have some roving mics, and introduce yourself and the organization you're coming from, and then frame the question as simply as possible. We could take 1 or 2 questions if there is interest.
My goodness.
Simon Capel.
Thanks. Simon Capel, Obesity Action Scotland. Firstly, thank you so much, Minister, for sparing time out of your crazy schedule. I love the bit in your speech about businesses in Scotland needing healthy workforces. And obviously, throughout today, we are going to be thinking about the commercial determinants of health, just like the tobacco industry 20, 30 years ago, we're getting pushback from junk food industry. I think this progress would, in your discussions with ministerial colleagues, do you think we're making progress in saying, yes, the economy matters, yes, employment matters, jobs, but also healthy workforce, healthy families now and in the future also matter?
Great. Simon, thank you very much. Yes, I do believe we are making progress. Do I think we've got more progress to make? Yes, I probably think we do. One of the areas that we've been working on, which ties very much into the public health framework, population health framework, is Marmot. And I had the privilege of listening to him speak about 18 months ago about the inequalities in health. And as a result of that, we have selected 3 areas of Scotland to become Marmot pilots within Scotland. And again, that's looking at your anchor organisations and your businesses. So NHS, council, but also there needs to be a business and, importantly, third sector community element to that as well. So I think that's a very good and positive progress. I had the enjoyment, because I'm an Aberdeen supporter, of being at the Cup final. Apologies to any Celtic supporters, but I can't help think this was a great thing that happened for Scottish football. I'd also been there in 1990 when Aberdeen beat Celtic on penalties. So I was actually sitting beside the owner of Aberdeen Football Club, and he was telling me about an idea that he had about trying to pool people, because football hits so many different groups of population within Scotland, not just back page, it's front page and centrefold as well. So he was thinking, what ways could football clubs get involved in public health? And I was really pleased about that, as was the chair of the SFA. So I would love to say watch this space. Let's hope we slam dunk into the top left-hand corner of the net, as Aberdeen did 3 times. Not that I'm bloating at all. But I think that's the way we've got to start thinking, is how we pull in the different businesses. So anchor organisations are really important. It's the connection that these anchor organisations have within their communities. And I'm hoping to visit Ayrshire and Lanarkshire and Aberdeen at some point to see how they are progressing with that holistic view. Is that okay, Simon?
All right, we will have one more question up there.
Hi, thank you so much. My name is Mona Hapka. I'm a lecturer in statistics at the University of Stirling with interest in preventive diabetes. However, my question relates. I live in Dundee and I have 5 kids, and my question relates to this. My oldest is 21, my youngest is 10, and in a matter of 10 years I have witnessed a decrease in food quality that is provided in schools, and I want to know if we can reverse that to at least what it was 10 years ago, if there's any plan for that. Thank you.
Great, thank you so much for your question. I suppose that it really gets to the nub of the matter, doesn't it? And if I look at my school photograph, which was more years ago than I care to remember, the difference in the difference of the children in the photographs, I suppose, is probably the right way to put it. I think does a lot to explain the importance of ensuring that children are getting the right nutrition from a very, very early age. And actually, my next visit after here, I'm going to a breastfeeding centre in Bathgate. And Scotland's done really well to encourage young mums to continue breastfeeding up to 6 weeks, and I think we've hit over 48% of the population, which is the start. And then I think you're right, it's the importance about the food that is being created in the schools. I've also done a visit where there's the connection with local shops to ensure that children are getting the opportunity to eat healthier food at breakfast time. And I think, so there's a lot of work going on there. But the most important thing that we've done as a lever is bringing in the Good Food Nation Act, and that is a requirement on local authorities to look at the food that they are providing within their schools. And I know I'll mention Argyll and Bute again. It's something that they've been working very strongly on Isla, where I live. The local butcher provides meat for the schools. So it's how you keep that food local as well as the quality. Now, I appreciate getting beef or meat locally in Glasgow isn't going to happen because the farm's not just down the road, or Dundee. But Dundee, so it's how do you work collectively with Angus and Perth and Kinross, and not just simply look at it at a Dundee city level. Think about Angus. Yes, exactly. Yeah. So look at the wider Tayside, because I was hearing yesterday that that's something that they're doing on the health boards as well. So the health boards and the health and social care partnerships are all coming together, which I think is really positive. Sorry.
That's good. No, thank you for taking those questions. In the interest of time, we might have to conclude the questions because the Minister needs to leave fairly soon. And Minister Minto referenced a resource the Scottish Obesity Alliance has developed with Cancer Research UK support that addresses inequalities in obesity, which is already coming up in both the questions as well as in the speeches. So as we conclude the opening session, may I request Minister Minto to release the fact sheet on obesity and inequalities in Scotland. And I'm going to ask Abigail, who has put in quite some effort into shaping up that fact sheet. So if you would like to hand it over to the Minister, and the copies of the fact sheet are in your folder. So.
Great. So it gives me great privilege to see this work finally coming to fruition, and I very much look forward to spending some time reading it and working out how we encompass that and how it's absolutely involved within the population health framework that we're looking at.
Thank you, that's helpful.
Okay.
All right, thank you so much then for coming and joining us. We would have loved you to stay on.
I would have loved to have stayed on as well.
But colleagues from the Scottish Government are here, so I'm sure you would get a briefing from the conference, and we will be in touch to follow up on some of the actions that emerge from the conference. So thanks again, and so we would straight away move on to the next session. So I'm going to ask Jennifer Forsyth, our Policy and Evidence Manager, to come and take us through that.
Thank you very much.